the discussion focuses on prostate cancer awareness. The segment addresses the difficulties men encounter when navigating prostate cancer diagnostics. PSA tests are a key element in prostate cancer screening and monitoring. Gleason scores provide a measure of the aggressiveness of prostate cancer. Treatment decisions for prostate cancer can be complex and require careful consideration. The aim is to provide clarity and support for men facing these challenges. PSA stands for a prostate-specific antigen. PSA is a protein produced by the prostate gland. The PSA test measures the level of this antigen in the blood. Elevated PSA levels can potentially indicate the presence of prostate cancer. However, elevated PSA levels do not always confirm a cancer diagnosis. In 2025, doctors are using personalized PSA level interpretations. This approach involves different cutoff points based on a man's age. Specific PSA level thresholds are established for men in their 40 seconds. Distinct cutoff points are also defined for men in their 50 seconds. Further age-related PSA level guidelines exist for men in their 60 seconds. Finally, unique PSA level interpretations are applied to men in their 70 seconds. Doctors are shifting from single PSA measurements to tracking PSA trends over time. Analyzing PSA trends provides a more comprehensive view of prostate health. A consistent increase in PSA levels over time can be a significant indicator. A steady rise in PSA may be more concerning than a one-time elevated reading. A change in medical approach aims to minimize unnecessary biopsies. This shift focuses on refining diagnostic criteria. The goal is to accurately identify patients who genuinely require invasive procedures. Reducing biopsies helps avoid patient discomfort and potential complications. It also alleviates the burden on healthcare resources. This approach helps prevent overtreatment. The Gleason score is a system used to grade the aggressiveness of prostate cancer. It is determined by examining prostate cancer cells obtained during a biopsy. Pathologists analyze the cellular patterns under a microscope. The Gleason score helps determine treatment options and predict prognosis. Higher Gleason scores indicate more aggressive and faster-growing cancers. The Gleason score is a system used to grade the differentiation of cancer cells in prostate cancer. It consists of two numbers, each representing a grade from 1 to 5. The first number indicates the grade of the most common cancer cell pattern observed. The second number represents the grade of the second most common cancer cell pattern. The Gleason score is a system used to grade the differentiation of cells in prostate cancer. It is based on the microscopic appearance of the cancer cells. Two numbers are assigned based on the primary and secondary patterns observed. The primary pattern represents the most dominant cell type. The secondary pattern represents the next most prevalent cell type. These two numbers are added together to obtain the overall Gleason score. The Gleason score is a key factor in evaluating prostate cancer. The order of numbers within the Gleason score holds significant importance. For example, a Gleason score of 3 plus 4 is distinct from a score of 4 plus 3. The first number indicates the primary, most dominant cancer pattern. The second number represents the secondary, next most prevalent pattern. Therefore, the sequence directly impacts the interpretation and prognosis. A Gleason score of 3 plus 4 equals 7 is used to grade the aggressiveness of prostate cancer. The first number, 3, indicates the most common pattern of cancer cells. The second number, 4, represents the second most common pattern. In this case, pattern 3 signifies that the majority of the cancer is less aggressive. The presence of pattern 4 indicates the existence of some higher risk cells within the tumor. Therefore, a Gleason score of 7.3 plus 4 suggests a mixed composition of cancer cells with varying degrees of aggressiveness. The Gleason score is used to grade the aggressiveness of prostate cancer. A Gleason score of 7 is composed of two numbers representing the two most common patterns of cancer cells. In a Gleason score of 4 plus 3 equals 7, the first number, 4, represents the dominant pattern. A Gleason score of 4 plus 3 equals 7 indicates a more aggressive cancer than 3 plus 4 equals 7. This is because pattern 4 cells are inherently more aggressive than pattern 3 cells. Gleason scores are utilized to assess the aggressiveness of prostate cancer. These scores are derived from a pathological examination of prostate tissue samples. In 2025, doctors integrate Gleason scores with genomic testing for improved risk prediction. Genomic testing analyzes the genetic makeup of cancer cells. This combined approach offers a more comprehensive understanding of cancer behavior. The integration enhances the accuracy of predicting cancer progression and treatment response. A common question in prostate cancer treatment involves choosing between surgery and radiation. Both surgery and radiation are standard treatments for prostate cancer. The choice between surgery and radiation depends on individual patient factors. This section will explore the considerations in determining the optimal treatment approach. Surgical prostatectomy involves the complete removal of the prostate gland. This approach is typically recommended for younger men in good health. It is often considered a one-time solution for prostate issues. The goal is to definitively address the problem through surgical intervention. Surgery recovery typically requires several weeks. The recovery period is essential for healing and regaining functionality. Surgical procedures carry inherent risks that patients should be aware of. Urinary leakage is a potential complication following certain surgeries. Erectile dysfunction is another possible risk, particularly in relevant surgeries. These complications may persist even after the initial recovery phase. Radiation therapy is a non-invasive medical treatment. It is often considered a primary treatment option for specific patient demographics. Radiation therapy is frequently recommended for men in their 60 seconds or 70 seconds. The suitability of radiation therapy depends on individual health factors. This treatment approach aims to target and eradicate cancerous cells. The non-invasive nature reduces the risks associated with surgical procedures. Radiation therapy typically involves a relatively quick initial recovery period. However, delayed side effects may gradually emerge over time. Common late side effects include fatigue, impacting overall energy levels. Urinary urgency can also develop as a delayed consequence of radiation. Bowel issues are another potential long-term side effect of radiation therapy. Modern medical technology is enhancing the safety and efficacy of various treatments. Robotic surgery represents a significant advancement in surgical procedures. Robotic assistance allows for greater precision and control during operations. SBRT radiation is another innovative treatment option. SBRT, or stereotactic body radiation therapy, delivers targeted radiation doses. These advancements collectively improve patient outcomes and reduce treatment-related risks. There is not a single best treatment option applicable to all situations. The ideal treatment is highly dependent on individual circumstances. Factors such as patient history, condition severity, and personal preferences play a crucial role. Treatment decisions should be made collaboratively between the patient and healthcare provider. A comprehensive evaluation is necessary to determine the most suitable approach. Flexibility and adaptability are key in tailoring treatment plans to meet specific needs. Effective treatment selection relies on individual patient factors. Age is a significant consideration in determining treatment options. Overall health status influences the suitability of different treatments. The Gleason score, indicating cancer aggressiveness, guides treatment decisions. Personal priorities, such as recovery speed or long-term control, also play a crucial role. The prostate cancer journey begins with a PSA test to screen for elevated levels. Understanding the Gleason score is crucial for assessing the aggressiveness of the cancer. Treatment options involve weighing the benefits and risks of surgery versus radiation therapy. The journey encompasses diagnosis, risk assessment, and informed decisions regarding treatment pathways. Knowledge is a crucial asset when dealing with prostate cancer. Understanding the disease empowers individuals to make informed decisions. Informed decisions can lead to better treatment outcomes. Knowledge helps in navigating the complexities of prostate cancer care. Empowerment through knowledge is key to managing prostate cancer effectively. Informed health decisions require a comprehensive understanding of one's personal health metrics. Individuals should explore the range of available treatment options. Staying informed about the latest medical advancements is crucial. Combining these elements empowers individuals to make confident health choices. The host provides a summary of the key health insights discussed. An empathetic tone is used to connect with the viewers. The host expresses hope regarding the viewers' health improvements. Viewers are encouraged to share the information and subscribe for more health insights.